my process of change project was based off of improper PPE used in the clinical setting. Um, this is kind of very different from a couple months back as far as PPE usage because now we're being told to reuse our PPE. So a lot of this stuff kind of doesn't apply now, but um, that's only because we're in a pan epidemic. So, yeah. Um, anyway, so some different things that could be considered as improper PPE are listed. Some are reusing your PPE or not wearing PPE whenever you go into a patient's room, or wearing them but not wearing them properly, such as if you go into an airborne precaution room but you're not wearing the proper N95 mask that you should be wearing, you're just wearing a surgical mask. That would be improper PPE. Also, in the clinical setting, I've seen different healthcare providers wearing PPE out into the hallways to say, like, go grab something, just so they don't have to, like take it off and then put it back on. And one of the articles that I found listed that some different common errors in putting on and removing PPE. So some of those are not tying the backs of the gowns properly, the gowns and the gloves coming in contact with the uniforms, or the bare hands while removing or disposing. So PPE is very important for healthcare professionals because it protects yourself from getting any type of pathogen that could potentially cause you to get sick or an infection or anything like that. So as healthcare providers, we should be wearing PPE it's just important. So one of the articles, actually it was a cross-sectional that I found, looked at the percentages of healthcare providers when they use certain PPE. So for one, on table 3, it's looking at when they use gloves during certain procedures. So some of these are pretty outstanding results here. And there was 57% that said that they never wore gloves when inserting an IV cannulation. And then only 10% said that they always used gloves. And with IV insertion, it's very prone to cause infection because you're inserting into the skin and going into a vein. And so you should always be wearing gloves. And the fact that there was only 10% of those who said that they always just use them is a very big issue that should be addressed. And then table 2 is talking about, or table 6, sorry, is talking about hand washing and when hand washing was performed. So one of the things was that 100% of participants said they never washed their hands before a procedure. So that's literally every single procedure on here that was listed: checking blood sugar, suturing procedure, and before inserting a Foley catheter. 100% said that they never washed their hands beforehand, and that's just pretty crazy. So some things that nursing management can do during the change of process. We learn about the change of process in our leadership and management class, so these are just some notes from it. Just first of all, you want to collect data on the information and then analyze that data, and then develop a plan from there. And then when you're developing this plan, you want to determine what the change should be, how it should be implemented, the resources that might be needed, and a way to get feedback on that. You want to try to create a readiness for change and identify opposers for the change. So one of the articles that I found was trying to figure out how many healthcare professionals were not using proper PPE. So it found that 325 were observed, and of those, 283 failed to use proper PPE before entering into a room. So another article, this one was actually from the Institute of Medicine. It was trying to find out different reasons why PPE would not be utilized. And so these are some reasons why. One being individual factors such as belief or attitude towards PPE. Another is environmental factors such as maybe not having the available equipment, which is the situation that we're in right now. We don't have enough N95 masks, there's not enough negative pressure rooms, and there's not enough gowns, so those things are having to be reused. And then organizational factors such as the management's expectations. So as a manager, we should be expecting our staff to be using proper PPE and encouraging them to use proper PPE. So some ways to, as a manager, to facilitate or to hinder the change of process. One, a manager could hinder the change of process by not performing PPE properly themselves. As a manager, we need to set an example for our employees. So every time that we're having to enter into a room, just making sure that we're doing the proper PPE that we need to be doing. And then also can facilitate change by encouraging and providing maybe even rewards or positive reinforcements for when individuals do use their PPE. Some of the following can affect change by the leader. This was one of the articles that I found. The first one is trust, and trust can be gained, and it can be used to improve the overall performance and commitment of the group members or employees. Only when the employees trust a leader will there be a change. Organizational culture. So you want this to be non-racial and non-judgmental work environment that is going to be built upon trust, and that will increase leadership and increase change. And then learning. One thing is that you never stop learning. The leader should learn continuously ways to improve their leadership skills, and through this, they can influence the change. And then teamwork and communication. These are great ways to bring about new innovative ideas. So you want to keep your employees involved and have them collaborate together to come up with a change together. This is another article that I found. It identifies factors that may promote a culture of safety within healthcare. So it just emphasizes the importance of having leadership within the workforce, and also having education and training and enforcement of PPE policy. So all of these things can improve the adherence of PPE use. So these are just some strategies that I came up with of how to implement change. So demonstrating the proper use of it with like educational seminars and in-services. Confronting those who do not use PPE, not just letting them get away with it. You need to actually confront them and say something about the improper use of PPE. Encouraging staff to report those who don't use PPE. And this isn't for them to get in trouble. It's just a way for us to know, getting that data analysis and knowing that it is an important issue and it's something that should be reported. And then you can either do positive or negative reinforcement. I would prefer to start with positive reinforcement. And then previously talked about the supervisor or management also using PPE and using it properly. And these are my references.